The House Rules Committee will come to order. Would the clerk please take attendance?
Chair Schuette?
Here.
Representative Zaragona?
Here.
Wenzel?
Here.
Martin?
Here.
Posthumous?
Here.
DeBoer?
Here.
Whitwer? Here. Liberati?
Here.
Herzberg?
Here.
Mr. Chair, you have 9 members present. You do have a quorum.
Thank you very much. Representative Martin moves to adopt the minutes of the October 30th meeting. And seeing no objections, the motion prevails by unanimous consent. The committee will be taking up House Bill 4926, and there is a substitute for House Bill 4926. It adopts the majority of the suggestions from the Department of Licensing and Regulatory Affairs, and the H1 substitute adds guardrails to ensure that the set-aside process cannot be abused by bad actors. And Representative Whitwer moves to adopt the substitute. Would the clerk please call the roll?
On the motion to adopt the substitute, Chair Schuette?
Yes.
Representative Zaragona?
Yes.
Wenzel?
Yes.
Martin?
Yes.
Posthumous?
Yes.
DeBoer?
Yes.
Whitwer?
Yes.
Liberati?
Yes.
Herzberg?
Yes.
Mr. Chair, you have 9 yeas, 0 nays, and 0 pass. The motion does prevail.
The substitute is adopted. And wishing to speak in opposition to the bill is Marnie Treemstra. I got it close that time. Please come forward and speak. Your mic, please.
There we go. I am Marnie Treemstra with the Lara Policy Office. I think the substitute is leaps and bounds better for the department. We really appreciate the cooperation and the language on making sure those guardrails are there. We are just still waiting to see language that provides funding for this new program. Once we have funding and we can support and implement this option for our licensees, I'd be happy to be supportive of the bill.
Well, thank you, Marnie. You know, we took, I think, 6 or 7 recommendations. Obviously, this is an area of ongoing discussion, and we'll continue discussion as it proceeds forward. So, thank you. Yeah. All right. Any other questions, members of the committee? All right. Representative DeBoer moves to report the bill with recommendation as substitute H1 as adopted. Would the clerk please call the roll?
On the motion to report, Chair Schuette?
Yes.
Representative Zaragona?
Yes.
Wenzel?
Yes.
Martin?
Yes.
Posthumous?
Yes.
DeBoer?
Yes.
Whitwer?
Yes.
Liberati?
Yes.
Herzberg?
Yes.
Mr. Chair, you have 9 yeas, 0 nays, and 0 pass. The motion does prevail.
The bill is reported with recommendation as substitute H1. And the committee will stand at ease.
Committee will please come to order. The chair recognizes Representative Schuette.
Thank you, Chairman Aragona. You wield the gavel very well there. So, House Bill 5127, and I appreciate the opportunity to testify in front of the Rules Committee today. House Bill 5127 is an effort to cut red tape to expand access to childcare in Michigan while protecting adjoining businesses in operations in mixed-use facilities. So across the state of Michigan, from Bay City to Battle Creek, it is not uncommon that a childcare facility is located within a multiple occupancy building. By being clear that the department cannot regulate areas within the building not part of or used by the center, we will ensure that other occupants' operations are not impacted. This will in turn expand access to childcare in our state by allowing more centers to occupy spaces in a mixed-use facility without the current barriers to entry caused by departmental overreach. House Bill 5127 would limit the department's ability to regulate childcare facilities to exclusively to apply to the childcare facility. And joining me today to testify will be Jacob Manning from the Small Business Association of Michigan, who can speak more to how this bill will help provide more childcare access throughout the state.
Thank you to Chair Schuette and members of the committee for the opportunity to come speak today. My name is Jacob Manning, and I am the Advocacy and Policy Manager for the Small Business Association Michigan, also known as SBAM. With more than 33,000 members across all of Michigan's 83 counties, SBAM is the largest state-based organization of small businesses anywhere in the country. We are here today to express our support for House Bill 5127. This is a bill that would clarify Michigan's Department of Lifelong Education Advancement and Potential, or MyLeap, and clarify that they can regulate the licensed childcare space itself, but not unrelated tenants of multi-use buildings or unrelated areas of childcare centers. Here at SBAM, we are engaged in the childcare conversation in multiple ways. We hear consistently from our non-provider members that childcare remains one of the leading obstacles in workforce shortages and employee retentions across the state. We also recognize that childcare is a sector that is primarily dominated by small business providers, many of whom are our members. In fact, we work directly with providers through our Nurture Benefit Program, which is a partnership with MyLeap to help providers offer competitive benefit packages for their employees. We know that there's no single silver bullet fix that will automatically solve our state's childcare shortages overnight. But that being said, we hear from our providers that unnecessary or unclear regulations are one of the key inhibitors for their growth, success, and expansion opportunities. House Bill 5127 takes a meaningful and practical step towards improving our regulatory framework. The bill ensures that providers can focus their attention to the licensed childcare space where children are actually present, rather than devoting time and resources to managing unrelated areas of a building, oftentimes outside of their own control. I want to emphasize that this bill does not weaken health and safety protections. MyLeap plays an essential role in the process of inspections and regulations for childcare facilities, and they are among some of our most valued partners at SBAM. The agency has dedicated a significant effort to alleviate the burdens on providers wherever practical, but every provider will tell you that the most important part of their work is ensuring the health and safety of their kids. This bill does not strip away any of the agency's ability to do their job, but helps ensure that the main thing stays the main thing. And it ensures that providers are not penalized for aspects of their center that are entirely unrelated to what should be regulated. So with that, I want to thank Representative Schuette for introducing this bill, along with the vast portfolio of bills that have been introduced this term as a part of the red tape reduction effort. We urge your support of House Bill 5127. Thank you for your time and consideration. I'd be happy to answer any questions you may have.
Great, thank you both. Real quick, how many members do you think of SBAM would this affect?
I don't have an exact number of how many of our members are child care providers. That is probably something that that I could get for you and follow up.
Cool, thank you. Any further questions from the committee?
And I just know anecdotally from in my region, both Greater Midland Community Center and the YMCA in Bay City are two mixed-use facilities that provide childcare. This would help them a lot to make sure that they're able to provide the greatest number of parents to have access to childcare.
Great. So. Thank you. Questions? Representative Martin.
Thank you, Mr. Vice Chair. So more beholden on the child care center to make sure that the building is suitable to do child care, and Laura would still come in and do an inspection, which was it, say, annually?
Yeah.
Or just upon renewal of license?
And upon the renewal of the license,
So
and yeah.
So if there's like social counseling for probationaries and so forth that have limits of how close they can be to children on some offender list, or I don't know, anything else that has a limit like 1,000 feet, like dispensaries or anything like that, this would all be.
Yeah, hazardous protections like regarding sale of alcohol, sale of and also restrictions for people being within reach of minors. That's also those provisions would remain. So.
Well, there's protections. Thanks.
Further questions from the committee? Being none, thank you both. Committee will go at ease. Call the chair.
The committee will come to order. I also want committee members to review written testimony and support from Terry Johnson and Andrea Secrease from the Greater Midland Community Center. And do we have any other cards on that bill? Great. All right. We will next be hearing testimony on House Bill 4915, and Representative Maddock will be testifying. Representative, come forward and please begin when you're ready. And you'll be joined by Dr. Rishi Mahabir from Do No Harm, also testifying in support.
I'd like to make a correction to the record. He is not with Do No Harm. He is here independently on his own.
Oh, great. Here independently on his own. Thank you very much for the correction.
And I believe that this is my 4th time on the 4th floor. Don't get up here very often.
There you go. We're happy
Thank
to
you,
have
committee
you.
members, for having us hearing today. This is a great bill to end implicit bias. You know, doctors are some of the greatest people we have in our state, and we need to do everything we can to make it more comfortable for them to do business in our state, and this is something that makes many of them very uncomfortable. When I was doing my research in this bill, I realized that I am very biased. I really hate Marxism and the social division caused by awful policies like this. And so that's my bias, to be honest with you. And I hope you enjoy what the kind doctor has to say today. He's really passionate about this, as are many doctors in your profession. And we're just happy to have him here today so he can tell us about what's really going on with this horrible policy.
Thank you. Thank you so much for letting me speak with you in front today. As he had mentioned, I'm representing myself and not an organization. My name is Rishi Mahabir. I'm an osteopathic physician. I've been practicing psychiatrist here in Michigan for about the past 17 years. I'm writing this testimony to strongly oppose the continuation of mandatory implicit bias training for healthcare professionals under the Michigan Public Health Code. Implemented by Laura in 2022, this requirement mandates a 1-hour training per year of licensure, totaling 3 hours over a typical 3-year renewal cycle. The proposed intent of implicit bias training is to address the unconscious attitudes and stereotypes among healthcare professionals that can influence perceptions, actions, and decision-making that may contribute to unequal treatment of individuals based on characteristics such as race, ethnicity, gender, disability, and socioeconomic status. The training aims to educate professionals on recognizing and mitigating biases to promote more equitable treatment and reduce disparities in healthcare delivery. In June of 2023, I participated in and completed a 3-hour live online mandatory implicit bias training for my state license renewal. It became quickly apparent that the intended purpose of the training had missed its mark by a wide margin. The first seconds of the meeting, I pretty much checked out. I was told that I was a racist and I was biased towards all my patients. It's kind of hard to sit there and to learn something when the first couple seconds of the meeting you're being told that you're a racist and being biased towards all your patients. It's not conducive for learning, in my opinion. The training assumed that I, along with my healthcare colleagues, are inherently biased and or racist. The training felt more like indoctrination than education. It felt unnatural and forced. The content pushed a social agenda unrelated to medicine, ignoring evidence-based medicine and patient care. In my opinion, implicit bias training is forcibly injecting social agendas into the practice of medicine. Patient outcomes should be the priority, not political or ideological agendas. Instead of fostering understanding, the training reinforces divisions. It encourages racial profiling in medicine. It inverts medical judgment and prioritizes ideology over evidence. I firmly believe that implicit bias training is an ineffective, ideologically driven component of the Diversity, Equity, and Inclusion Initiative, also known as DEI. It has no place in medicine. The practice of medicine must remain evidence-based. Implicit bias training diverts valuable time from core clinical education, fosters division among providers, and fails to improve patient outcomes. Even 3 hours is 3 hours too much, in my opinion. Like poison, even in a small dose, it could be lethal, undermining the scientific foundation and professional autonomy of medicine. Mandating courses in implicit bias training assumes all providers harbor biases that need correction. That, in turn, can breed resentment and undermine trust in the medical community. From a psychiatric perspective, forcing ideological training on individuals risks psychological harm. Participants may resist the top-down mandate that feels accusatory. DEI-driven mandates like implicit bias training erode professional autonomy, compelling physicians to endorse viewpoints that may conflict with their ethical or scientific beliefs, bordering on compelled speech. As a psychiatrist, I treat patients across diverse backgrounds and know that genuine equity comes from individualized care and not rote DEI exercises that treat providers as inherently flawed. Michigan's mandate affecting physicians and other healthcare professionals exemplifies government overreach into clinical practice, prioritizing political optics over patient welfare. Mandatory implicit bias training is a flawed DEI policy masquerading as medical reform. It lacks empirical support, risks harming provider morale, and distracts from true advancements in healthcare. I implore members of the House Rules Committee to advocate for its repeal. Let's return medicine to its foundation, which is science, compassion, and evidence, not ideology. I appreciate your time. More than welcome to take any questions that you might have.
I just have one quick question, Doctor. How many patients, when we met this morning for the first time, you said you had to reschedule all your patients to be in Lansing today, and you've been here approximately 2 hours, right?
Right.
And you're going to be here another maybe an hour before you get back to your practice. How many patients did you have to? How many patients do you see an hour?
I do medication management, so it's 3 patients per hour. So today, as I said, I rescheduled 21 patients. I average about 60 to 70 patients a week.
Okay, so we have 22,000 doctors in Michigan, roughly. And I mean, doctors' time is extremely valuable. If anyone has ever been in the hospital, everyone knows how busy they are. And for a doctor, you know, it may not sound much, but when you add up the time spent doing this horrible training, it's roughly 66,000 hours. And that's a lot of patients doctors aren't seeing in 66,000 hours. I just want to point that out to the committee.
And what I may add to that is 1 second of the training, in my opinion, is 1 second too much. If it was scientifically based, if it was evidence-based, that'd be a different thing. This is not scientifically based. It's not. There is no randomized controlled trial that I know of that shows that implicit bias training is effective. There's none. Randomized controlled trials is the gold standard of evidence-based medicine.
And
There's no randomized controlled trial that I know of that says implicit bias training is effective.
And Doctor, you know, this is a directive that was put in place in 2020 for, you know, the hundreds of years of the existence of the medical profession before this. Have we, in the years since it's been implementation, have we noticed any increases in broad quality of care, decreases in cost after implementing this implicit bias training?
I have not noticed any positive.
You don't see any evidence in the data in the field as somebody who's very familiar with it?
I've seen more physicians, more healthcare professionals. Like I said, it starts off as an accusatory premise. It's pushing away physicians. It's pushing away healthcare professionals from the state of Michigan, in my opinion. It is. I think there is obviously a lack of healthcare providers in Michigan. This mandate is just going to make it worse, in my opinion. you know, it's one thing if it's a mandate, it should stand on its merit, in my opinion. If it's effective, it should stand on its merit. It should not be mandated.
Thank you. Vice Chair Whitwer.
Thanks for being here today. I appreciate it. It sounds like, you know, your first couple of minutes were pretty uncomfortable and offensive to you. And I can tell you that when I first got elected, I went through implicit bias training. I just wanted to experience it. And I can say I felt like I was extremely uncomfortable going through it. And I realized I had biases, much like what you mentioned. And I didn't realize that they were there, and it was pretty eye-opening. And I spent 22 years in healthcare, and I spent probably the first 5 on the floor in the burn unit, and I spent probably 10 in marketing, understanding the differences between how different ethnicities are treated and how they present actually with specific kinds of illnesses and diseases, and some more than the other. And I really would like to know, outside of it making us uncomfortable and outside of it offending us, how it is a bad thing for doctors, nurses, healthcare people that deal with people every day, not just the science of it, but when I go to my doctor and I talk about my life too. And they want to talk about how I feel in my life, and could I be depressed from this job, and different things. So I don't understand how it is a bad thing to learn about implicit bias so that you can understand the different people that we deal with in a daily basis, especially in healthcare. It's your most personal relationship you have outside of your own family. And then what evidence do you have that supports that this is pushing doctors away? You're speaking about evidence. What evidence do you have that this is pushing doctors away from the field?
The evidence I have is it's anecdotal.
So it's not evidence then?
I'm sure I could get you evidence if you provide me with your contact information. I could provide you with evidence, data, research. Your first question. We all have, there's racial disparities in medicine. That's a known, that is a given, yes. But we need to have a more effective treatment for addressing racial disparities. Implicit bias training, there is data after data after data that shows it is not effective. We need to go back to medicine. We need to go back to truth. We need to go back to the foundations of medicine. For example, standardized protocols. That takes out racial biases in treating patients. Standardized protocols, basically, for example, if you have a patient that comes into the ER with chest pain, okay, we're looking at step 1, vitals, step 2, what do we, medication regimen do we need to get them started on? We're now looking at their race. We're now looking at the color of their skin. It's a standardized protocol. There is several randomized controlled trials that show that evidence-based medicine is the only way we could address the racial disparities. There's also, the advent of AI technology that's been very effective in removing racial biases in medicine. And of course, there's also voluntary case reviews where you have a case presented to you in front of a group of other physicians, and you go over what did we do wrong, what did we do right. You're not being forced to sit there and listen to somebody tell you that you have inherent biases. You're looking at the medicine, you're looking at the facts, and that's the way medicine should be, in my opinion.
Vice Chair Whitwer.
Just a follow-up. I'm curious because I looked at who supports and who opposes, and I don't see like MSMS supporting it. I don't see any doctors' organizations supporting this. So if there were these evidence-based that this is pushing doctors out, are you planning on getting those supporting those big associations of docs if this is so offensive to doctors to do this? And I do see that the nurses are not for it. So just wondering, like, are we going to talk to the doctors about this?
Right, yeah. I would believe so. I would believe so, as, you know, I'm a volunteer of Do No Harm. Now we have over 40,000 members in our organization, and we are all of the like mind that this training has no merit whatsoever. And you had mentioned, you know, other organizations, like, for example, the American Medical Association and the American Pediatric Association. We're trying to get them on board with us, but you have to remember, these are the same organizations that feel that gender transition surgeries on children is okay. So we have a lot of work to do here to get back to medicine, back to
Thank you, Doctor. Representative DeBoer, you have a question? Mm-hmm. Yeah. And we have a couple other bills too, so if we could
Oh, I'm sorry,
keep
I
it tight,
apologize.
yeah, mm-hmm. Yeah. Mm-hmm. And Nancy, can you hear your mic, please? Yep, of course.
I appreciate you coming here. It's not easy to do. And I know you face a lot of things that go through your own mind after being condemned as you turned on the 3-hour presentation. My husband came home from the beginning of the school year, and they had a presentation similar to that. And he was the most depressed I've ever seen him. After the opening for the school year, he loves to teach. He loves children. It doesn't matter what color they are. He loves to make them sing. He loves to bring out the very best in every child, in every concert. He gives his life to helping them understand how to be the best they can be. And he's taught like 10,000 children. And everyone that comes up to him in Myers or whatever, they'll stand and they adopt this posture of having been in his concert and wanting to produce the very best. And their parents would dress them accordingly, and fill the auditoriums. Thousands of people would come to hear the Christmas celebrations and everything. And it was not about bias, never about bias. And he came home so hurt by all those accusations and all that pummeling of him psychologically. From a crude
Nancy, so we've got 20 minutes. I'm sorry. Yeah. Thank you, but I appreciate it. And thank you for your testimony, gentlemen. And Nancy, thank you for your support. Yep. All right. Next, we will be hearing. We have not wishing to speak, submitting written testimony in opposition. Kaylee Hunt from the Michigan Nurses Association, and submitting written testimony in opposition is the Michigan Dental Hygienists Association, and submitting written testimony in support is Dr. Maselli and Dr. Sarah Anuldo, volunteers with Do No Harm. All right, and now we will be hearing testimony on House Bill 4881 and 4882. Representative Neyer will be testifying. Representative, please begin when you're ready.
Sorry. Thank you, Chair and Committee. This is also part of the red tape package of removing bills that are no longer effective here in our state. 4881 and 4882 it is a bill package, or it removes regulation that is placed upon potato wholesalers and requiring them to have bonds in case of non-payment to the producers. This act has not been very relevant for several decades now, and has little or no effect, especially now that there are federal guidelines in place that do protect the producers for payment that are far more effective and basically duplicate of this. The potato industry in the state is a $2.5 billion plus business in the industry, and a $100,000 bond, which is required on wholesalers, has very little effect or very little benefit for the producers. Currently, right now, it's managed underneath MDARD. There's less than 10 producers or wholesalers that are involved in the process. Very little relevance to that, and I feel that these MDAR's resources be better spent. This has full support of the Michigan Potato Industry Council, or Commission. And with that, I ask for your support on 4881 and 4882. I'm open to any questions.
Well, thank you, Representative Neyer. It is pretty incredible that we still require a license for this, and you've mentioned broad stakeholder support, including the department. You have and the Potatoes Council. So this seems like something that is supported both by agency and by the industry. So appreciate your due diligence. And with regards to the Agriculture Committee, this came out unanimously.
Came out unanimously, and also Kelly Turner from the potato industry gave a testimony there in full support of this, gave some more details on basically the irrelevance of the program, and it's just more of a burdens to the industry and not very good use of MDARD's time.
Great. Well, thank you. And any questions from members of the committee? Great. All right. Well, thank you very much, Representative. Representative, you're good to go. Thank you very much. All right. We are awaiting Representative Outman, who will be testifying in support of 4914. I'm told he is on his way over, which is good. Committee will go at ease. The committee will come to order. And yeah, fresh out of economic competitiveness, we will now hear testimony on House Bill 4914, and Representative Outman will be testifying.
Oh, there we go. Green button lights up. Let me get my notes real quick. Well, thank you, Chairman Schuette, members of the committee. Here to talk to you about cryptocurrency. Just kidding. We just had a whole hearing on that where both Chairman Schuette and Brian testified. I'm here to talk about something else. Here to talk about my bill, House Bill 4914. And what that would do is that would simply remove the requirement that 2/3 of a firm's principals be licensed to practice architecture, engineering, or surveying. Now, this bill comes from a February 2025 Lara report outlining ways in which the legislature could cut unnecessary red tape and promote businesses here in Michigan. Now, the removal of this requirement would not impact public safety or the quality of work being done. Any project being done would still have to be performed by an individual licensed by the state, regardless of the firm's ownership. Now, my hope in this bill is that it would also pave the way for an increase in the number of firms in the state. By removing that 2/3 ownership requirement, we open the door to more people taking a chance in opening a new business. So again, Chairman Schuette and committee members, I thank you for the time and would welcome any questions at this time.
Thank you, Representative Outman. First question. I know that, just as a point of clarification, states in our region, do they have this 2/3 requirement?
So not many. We are somewhat of an outlier here in this country, as a matter of fact. But specifically in the Great Lakes region, we are an outlier. For example, you look at the state of Wisconsin. They do not mandate licensed professional be responsibly in charge. You look at the state of Ohio. They still have a threshold, but it's a lower threshold. So 50% of the owners have to be a licensed architect, engineer, and surveyor. Indiana does not mandate any sort of licensed professional ownership ratio. So specifically in our region, it does seem like we are an outlier. But more broadly speaking, there's 27 states that use a more responsible, flexible charge model than what we're practicing here in the state of Michigan. Again, we are at 2/3 ownership ratio for those companies.
Thank you. And so work being completed by one of these firms, it would still have to be done by a licensed professional, correct?
That's correct. Every project has to be signed, stamped, and sealed by a licensed architect, engineer, or surveyor in this case.
And so on the project, they'd still be subjected to those public safety standards that normal work is required.
And it's important to keep a note that even here in the state of Michigan, where we have that 2/3 ownership ratio requirement, 2/3 of the owners do not have to sign off on a project. It is still up to one licensed professional that signs off, gives that architecture stamp on a project. So really, just the ownership ratio doesn't make sense to me. It seems like a way to protect your turf, so to speak. And I think we would do Michigan a great deal of service by removing this unnecessary burden, in my opinion.
Great, thank you. Representative Martin?
Thank you, Mr. Chair. So Wisconsin and the other surrounding states, have we lost business to them, or do they have larger business in the architectural engineering businesses than we do? Do we have a statistic on that we're losing business to them because they have a different requirement?
I don't have any statistics on that specifically, but I do know that in those states where they have a more flexible model, there's no safety concerns by any means, and that's what the architecture groups and some of these stakeholder groups are going to come up here and say, that private equity is going to come over and take over all these companies, and that they're just going to be signing off on unsafe projects. That has not been the case in those other states.
So the other businesses, since an architect signs off on it, do they design buildings in the state of Michigan from out of state?
I would assume
it's just
so.
For ownership in the state of Michigan. Doesn't mean that an out-of-state one can't do business here. Do we have more businesses going to the out-of-states because of that?
It's possible. It certainly
Possible.
It's certainly an outdated and anti-competitive.
Do we have testimony from the professional organizations saying that? Or is it just Lara's review?
Well, I don't know. That hasn't been brought up to me specifically. Like I said, the stakeholders, the ones that I've talked to, their big fear is that these big private equity firms are going to be coming in, taking over, and these people are going to be, these architects, these licensed professionals are going to be you know, they're going to be signing off on these unsafe projects because of that influence.
Right,
Supposedly,
but that just brings up the point. The way we do business in Michigan may not be the same as other states, but it doesn't appear to be broken in Michigan to be a repair for any kind of safety thing. So it's not broken in the state of Michigan, it's just not the same as other states.
Yeah, I mean, I would say that's a pretty fair assessment. I mean, again, I think it's anti-competitive. You know, I think we do potentially lose.
Allegorically, I'm trying to say two words at once. Yeah.
Both of those words would fit. We created a new word in the rules
That's what I'm
committee.
saying. We haven't had a trade association's testimony on that.
No, and it's not one of their priorities. Obviously, again, I feel like they want to protect their turf more than anything, but again, that's my humble opinion.
Representative Whitwer?
Thanks, Rep. Outman. Just curiously, I have a family member that is an architect and many that are engineers. And if this requirement is eliminated, will there be an increase in public problems with public safety? Because I mean, I see what he does, and it is such minutia that I would have never thought of, and it is there just to protect all of us, like what happens in this Capitol. And will it be a risk to the public safety?
I don't think so. In the 40 other states that don't have this strict requirement, that hasn't been the case. So I would argue no, the evidence isn't there for that.
Okay, and Representative Wenzel?
So how many other states have a licensure requirement, either individually or firms?
So there are 12 states in the union that have this 2/3 requirement. There are 7 additional states that have a more stricter requirement, oddly enough. Now, there are sub-states that had this requirement and then actually rescinded them. I use Iowa as an example. They had this 2/3 requirement. They repealed that back in 2014. And there's been no concerns from what I can see regarding that.
So I guess, and who is wanting this? It seems like we're trying to like fix, to Representative Martin's point, we're trying to fix something that doesn't seem to really be a problem to me.
So obviously, our whole mission here is to reduce red tape. I mean, so even if we're not seeing a huge issue with it, does that regulation make sense? I mean, is it anti-competitive? Is it preventing people from getting into the marketplace? So that's my counter to that. I mean, I haven't heard a lot of concerns. It just seems like an unnecessary regulatory burden that we could at least pare down, if not outright eliminate. And the Department of Lara, I mean, they issued their red tape report. This is one of their ones that they highlighted that says it doesn't make sense, get rid of it. And I agree with them.
You know when this law was enacted, when the 2/3 came about?
I think it's quite old. I don't know exactly the genesis of it, but I believe it's been in place for quite some time.
Any other? Representative DeBoer?
I know, like in the medical profession, depending on who's an administrator of the office can change the dynamics of the care. And so my daughter-in-law worked at a clinic in Virginia, and they could do like a half-hour appointment, and then they got a more administrative person to run the office, and with more of a business focus, and it went down to like 15 minutes or 10 minutes, and it was very, very hard to do quality care and understand the patient's issues. And I've heard of other doctors that have left the regular GP world because of administrative overreach that makes their appointments so short that they feel they can't do the job they want to do for patients.
Sure.
And so when I heard of this, it gave me that same kind of catch in my heart that, yeah, you don't want to have that we understand what we do and no one else can be a part of it. But you're not saying that if you have a 2/3 administrative group, you can still have business-minded people, but you don't have, and some of these equity groups really have no heart at all. And I can see why they would be concerned about that. And it is.
So what is your overarching concern, I guess?
That safety.
Safety. So again, even if we've removed this, strange ownership ratio. Every project has to be approved by a licensed professional. Do we not trust those licensed professionals? Do we not think that they're gonna, take due diligence or put their reputation on the line to sign off on something that's unsafe?
Not initially, but they can be pressured. They can have administrators that say, you're going to lose your job if you don't follow the, we got a lot of people waiting in line for your position. Too bad for you. I'm sorry, but it is a depraved world and people get pressured.
Again, do you think a licensed architect and engineer is going to sign off on an unsafe project?
It wouldn't be horribly unsafe, but they could skirt things just for pressure.
And members, I appreciate this discussion. I think we're adjourning in a minute here, and I appreciate that. We have a lot of cards of opposition. We're not going to be voting on anything today. We'll give you time to testify in the future next time we bring the bill up. So apologies for that. It's, time got out of our hands. Representative, we have no absent members, and committee will stand adjourned. Thank you. Looks like we're going to have to take a look at this one. Yeah.